Welcome to the Surgical Edge podcast for surgical insights, reviews, discussions, and to stay updated. Let's dive in.
Welcome to the Deep Dive. We're here to take a whole stack of info and, well, boil it down to what's really important, interesting, and sometimes pretty surprising for you. Today, we're jumping into something that's really changing one of the oldest things humans do, surgery. Think about it. Complex operations used to mean huge cuts, long stays in the hospital, lots of pain. Now, picture a future that's actually kind of already here, where everything's about precision, recovery's way faster, and human skill gets this incredible boost from machines. So our mission today, we're going to unpack how robotic surgery works, look at the really surprising benefits, and see where it's being used, all based on the research we've gathered. By the end, you should really feel like you've got a solid handle on this medical marvel. We'll cover the what, the how, and definitely the why it matters, plus what's happening now and what's next. Okay, let's get into it.
Yeah, it's amazing how fast this stuff has gone from like science fiction to being pretty standard in operating rooms everywhere. So at its heart, robotic surgery, it's a minimally invasive way of operating. It uses these advanced robotic systems, and it's been quietly changing general surgery for, wow, over 2 decades now. It lets surgeons do really complicated things much more accurately, and maybe the best part for the patient, with way less trauma.
You know, when people hear robotic surgery, I think they often picture like a robot just doing the whole operation by itself, right? Like out of a movie. Can you maybe explain what the surgeon actually does? How is it different from that idea?
Right. That's a really key point. It is absolutely not some robot working on its own. Think of it more like a super sophisticated, really precise tool that extends the surgeon's own hands and eyes. There are basically 3 main parts. First, the surgeon console. That's where the surgeon sits, usually comfortably, actually. They're looking at this amazing high-definition 3D image of exactly where they're operating, and they control the robot arms using these very sensitive hand and foot controls. It's almost like a super advanced flight simulator, but, you know, with much higher stakes.
Okay, so the surgeon has this incredible view, super precise controls. What's actually interacting with the patient then, inside the body?
Right, so that's the second part, the robotic arms. These arms hold tiny little surgical instruments, maybe only a few millimeters wide, and a small camera that sends back that 3D image. They're designed to perfectly copy the surgeon's movements from the console. But here's the thing, they do it with enhanced precision, and this is crucial, they filter out any tiny natural tremor a human hand might have.
Wow, no shaky hands.
Exactly, and these arms are attached to the third part, the patient side cart. That's the big unit positioned right over the patient, and it's what holds and moves the arms based on the surgeon's commands, all in real time.
And that term we keep hearing, minimally invasive,
Yeah.
that's a huge plus, right? What does that really mean for, say, someone listening who might need surgery compared to the old way, the open surgery?
Oh, it means a much, much better recovery, usually. Instead of one long cut, maybe several inches, that goes through muscle. Robotic surgery just needs a few small holes, sometimes called ports, often less than half an inch each. And that directly means less blood loss during the operation, usually a much faster recovery time after, and definitely a lower risk of things like infections. It's really a game changer for how patients experience surgery.
That makes sense.
And yeah, when we talk about these systems, probably the best known one is the Da Vinci surgical system. It's been around the longest and is used the most. But it's important to say there are newer systems coming out now, pushing the tech even further, bringing in competition.
Okay, so the patient benefits are clear. Less invasive, faster recovery.
Yeah.
But beyond that, how does robotic surgery really push what surgeons can do compared to, say, standard keyhole surgery, laparoscopy, or the old open methods? This is where it gets kind of exciting, technically.
Well, yeah, thinking about capability, it honestly lets surgeons do things that were just incredibly difficult or impossible before without a big incision. One of the biggest advantages is that enhanced precision and dexterity. Those robotic arms, the wrists on them, can rotate a full 360 degrees. Think about your own wrist. It can't do that.
Right, no way.
So imagine trying to sew something or make a really precise cut deep inside the body in a really tight spot where your human wrist just can't bend that way. The robot can do it, often through one of those tiny little holes.
Yeah.
That's kind of the wow factor for surgeons doing these super delicate tasks with amazing control in places they couldn't easily reach before.
That 360-degree rotation sounds like a huge deal for tricky spots.
Right.
And you mentioned the view the surgeon gets. How does that help? Is it just like a better TV screen?
Well, it's a bit more than that. The improved visualization is another massive plus. That high-def 3D image isn't just clear, it's magnified. Surgeons can see tiny nerves, tiny blood vessels, much better than they could with the naked eye or even standard laparoscopy. It gives them this incredibly stable, detailed view.
Right.
And, there's another side to it, too. For the surgeon, sitting at that console is much more comfortable than standing hunched over an operating table for hours. So it leads to reduced surgeon fatigue. And if you think about really long, complex operations, maybe 6-8 hours,
Yeah.
a less tired surgeon is likely a safer surgeon towards the end of that case. It's not just comfort, it potentially impacts outcomes.
That makes total sense. A win-win.
Yeah.
Better for the patient, easier on the medical team. So leaping back to us, the patients listening, can we just quickly recap the direct benefits we should really care about?
Absolutely. The main patient benefits are pretty significant. So going back to that minimally invasive part, smaller cuts mean less pain after surgery. Obvious, but important. Less scarring, too, which matters to a lot of people. And as we said, a much lower risk of infection at the incision sites.
Okay.
And all that usually adds up to shorter hospital stays, you get home sooner, and often faster recovery times overall. People can frequently get back to their normal lives, back to work, back to hobbies, much quicker than they could after a big open operation.
It really does sound incredibly positive, almost too good to be true sometimes. Like,
Yeah.
with any big technological leap, there got to be some, I don't know, downsides or challenges, right?
Yeah.
What are the hurdles hospitals and surgeons run into?
You're right to ask. It's definitely not perfect, and there are real challenges. First off, these systems have high costs. Buying the robot itself is a huge investment for a hospital, millions of dollars. And then there's ongoing maintenance, specialized instruments that are disposable. It all adds up. That can be a real barrier, especially for smaller hospitals or healthcare systems with tight budgets.
Okay, cost is a big one. What else?
Then there's the learning curve. Surgeons need a lot of specialized training to get good at this. It's not like just picking up a different scalpel. They need simulation training, supervised cases. It takes time and commitment to become really proficient.
Right, it's a whole new skill set.
Exactly. And one other thing, it's a bit more technical, is the limited haptic feedback.
Haptic feedback, you mean like the sense of touch?
Precisely. In traditional surgeries, surgeons can feel the tissues, how tough they are, the resistance when they pull on something. With most current robotic systems, they don't get that direct physical sensation. They have to rely much more on their visual cues, how the tissue stretches or moves on screen, rather than that sense of feel. Experienced surgeons learn to compensate, but it's still a difference.
Interesting. So, okay, we have these amazing capabilities, but also some real challenges like cost and training and that lack of touch feedback.
Yeah.
Given all that, where are we actually seeing robotic surgery make the biggest impact right now? Which operations are really benefiting most today?
Well, the list keeps growing, honestly. It's being used across many areas of general surgery now. For example, robotic-assisted cholecystectomy, that's gallbladder removal, really common operation. Here, the robot's amazing view, that 3D HD vision, really helps the surgeon clearly see the bile ducts and the surrounding structures. This can reduce the risk of injuring something important, especially if the anatomy is a bit tricky or inflamed.
Okay, gallbladders. What about hernias? Those are super common too.
Definitely. Hernia repair is another big area. Inguinal hernias, ventral hernias, hiatal hernias near the esophagus. The robot's precision is fantastic for placing the mesh reinforcement exactly where it needs to go and suturing it securely, particularly for complex ones, like repairing large hiatal hernias up near the diaphragm. The robot's dexterity allows for really fine dissection and stitching in that tight space. Studies suggest this can lead to fewer hernias coming back and maybe less pain after surgery compared to some other methods.
Okay, and if we move further down the digestive system, colorectal surgery sounds like it could be pretty complex.
Oh, absolutely. And that's where robotics has made a huge difference in colorectal surgery. Think about operations for colon or rectal cancer, like colectomies or removing the rectum, a proctectomy. Especially for cancers low down in the pelvis, it's a very narrow, confined space. The robot's wristed instruments and stable camera view are a massive advantage for doing the delicate dissection needed down there.
I can imagine.
And a really important benefit here is better preservation of the nerves in the pelvis that control bladder function and sexual function. The improved view and precision can help surgeons avoid damaging those nerves, which can make a huge difference to a patient's quality of life after cancer surgery.
Wow, that's a really significant impact. What about weight loss surgery? Bariatric procedures?
Yes, bariatric surgery too. Procedures like the sleeve gastrectomy or the Roux-en-Y gastric bypass often involve a lot of precise stapling and sewing. The robot can offer enhanced control and accuracy for that, especially in patients who have a very high BMI, where the thickness of the abdominal wall can make standard laparoscopic surgery more challenging. The robot can help overcome some of those access difficulties.
Does that make sense? Any other major areas? Seems like it covers a lot already.
Well, we're also seeing big benefits in esophageal and gastric surgery. For removing esophageal cancer, for instance, a robotic esophagectomy allows for incredibly careful dissection of lymph nodes around the esophagus, which is really crucial for staging the cancer and ensuring the best treatment. And for surgeries to treat acid reflux, like a Nissen fundoplication, that enhanced suturing precision is a real plus for creating an effective wrap around the esophagus. Even super complex areas like pancreatic and liver surgery are starting to see more robotic use. Things like the Whipple procedure for pancreatic cancer involve working around major blood vessels, incredibly delicate. The robot's stability and precision can be invaluable there, and using it for removing parts of the liver is also growing, though it's still evolving.
It's amazing how it applies to such different, really delicate operations. Is there anywhere it helps with maybe the cosmetic side of things too?
Yes, actually. In thyroid and parathyroid surgery, which normally involves an incision on the neck, surgeons can now use robotic techniques to go through the mouth, called transoral, or through the armpit, an axillary approach. This means they can remove the thyroid or parathyroid glands without leaving any visible scar on the neck at all. For patients who are concerned about that, it's a huge advantage.
No neck scar. That's pretty cool.
It is. And finally, it's even making its way into emergency general surgery. Things like removing an acutely inflamed appendix or repairing a perforated stomach ulcer. Even in these urgent situations, the robot's better maneuverability and clear view can be really helpful, especially when tissues are swollen or infected, which can make things harder to see and handle.
Okay, so it's really spreading across the board. We talked earlier about the challenges, the cost, the training, that lack of touch feedback. What's coming down the pipeline to maybe tackle those issues, and what are the really exciting sort of future possibilities for this tech?
Yeah, those hurdles are still there, definitely, but the future looks pretty exciting. One major area is artificial intelligence integration, AI.
AI in the operating room, how would that work?
Well, imagine AI acting almost like a co-pilot for the surgeon. It could analyze the video feed in real time, maybe highlight critical structures like nerves or blood vessels that need to be avoided, or potentially even analyze tissue characteristics to help differentiate between cancerous and healthy tissue. Or perhaps assist in planning the steps of the surgery. It's about decision support, making the surgeon even more informed during the procedure.
Wow, real-time AI guidance. That sounds potentially huge. What else?
Then there's something truly potentially revolutionary, telesurgery.
Telesurgery,
Right.
like remote control surgery.
Exactly. The idea is that a surgeon could be at a console in one city or even one country and operate on a patient using a robot located miles away, maybe hundreds or thousands of miles.
Oh,
Think about the implications for access to care. You could have a world-renowned specialist perform a complex operation on someone in a rural hospital or even in a different country without anyone having to travel. It could completely change how we deliver expert surgical care, especially to remote or underserved areas.
that would be absolutely game-changing for global health equity.
Amazing. And are we seeing anything happening with the robots themselves? You mentioned Da Vinci is dominant, but are there others coming along that might maybe help with that cost issue?
Yes, that's definitely happening. We're seeing the emergence of new robotic platforms. Companies like CMR Surgical with their Versius system, Medtronic with Hugo, Ascensa Surgical with Senhance. There are others too. This increased competition is really important. Hopefully, it will start to drive down the purchase price and the running costs of these systems. More competition, potentially lower costs, could make robotic surgery much more accessible to more hospitals and ultimately more patients around the world. It could help shift it from being a specialized tool in some centers to being closer to a standard of care more widely. So as we wrap up this deep dive then, it feels, well, abundantly clear that robotic surgery has really shifted the landscape of general surgery, hasn't it? It's allowing for these incredibly precise, minimally invasive operations across just a huge range of procedures from, gallbladder removals right up to really complex cancer operations.
That sums it up well. And while those challenges we talked about, cost, training, haptics, there's still real issues being worked on. The advancements happening now, like AI, telesurgery, new competing platforms, they all point towards even wider use in the future. As the technology keeps getting better and maybe more affordable, its role in making surgery safer, making recoveries faster, and maybe even enabling new procedures is only going to grow.
Which brings us to a final thought for you to mull over.
Welcome.
When we think about this blend of, deep human expertise and incredibly precise machine capability, letting surgeons operate almost at a microscopic level, potentially across huge distances, what could that mean for how we train surgeons in the future? And maybe even more profoundly, how might it completely reshape our ideas about who gets access to the very best healthcare, no matter where they live on the planet? Something to think about. Thanks for joining us on The Deep Dive.
Thank you for listening to the Surgical Edge podcast. Don't forget to like, share, and subscribe. Help us grow and deliver even more relevant surgical content by pressing the support button. Your contribution truly makes a difference. And don't forget to share with us your advice, feedback, and the topics you would like us to include.